Good evening, everyone. I felt like it was appropriate this evening to do an update since I know there's a lot of people that are worried and I'm getting a lot of questions, which I don't mind at all and fully understand. We did have our second positive student case come through today, and this was a middle school boy. So we've had one case at the high school and one case at the middle school. I think it's important for me to explain to you how we make the decision on who gets quarantined. This time we have had 17 students quarantined. We had 17 the last time also. Each time we had one staff member this time and two the last time. So to make that decision, we look at the same things that I've said, but I thought it might be good to repeat. Students that are less than 6 feet apart for 15 minutes or longer, and if you do not wear a mask. So we look at the seating charts on buses. We haven't had a case on the bus yet, but we look at those if we would. And in classrooms, and if your child is sitting somewhere and they're not 6 feet apart, even with their mask on, we take extra precautions to make sure that we can keep them safe. So that's the three things we look at. Did they wear a mask? Were they 6 feet apart in the 15 minutes? I've had people say, well, what's the magic number? That's the guidance we get from the health department. So that's what we use when we make those decisions. So we have made all calls based on this middle school case. So if you haven't received a call, your child is free to come to school starting again tomorrow. Also, I think it's good to know how we decide the number of days. So we are now making the decisions and making the calls for the health department because they're a little overwhelmed. Um, we aren't really as overwhelmed as they are, I don't think. So we're making those decisions. So it goes back to the date when the person, or in this case, student started exhibiting symptoms. So, for instance, the students that we just called tonight are only out until after Thanksgiving break because the student was here and had symptoms. So, their date to come back or go back to normal life is the 29th, and then they are coming back to school on the 30th. Or typically it's 14 days. So, in all of these cases, you know your kid, watch them, check their temperatures, all those kinds of things. But that's how we're making the decisions on who we quarantine and who we do not. Things that are outside we don't have to worry as much about those. In PE, he has them all spread out so they're not really coming into contact for 15 minutes or longer. So that helps us not quarantine as many people. People have been asking me, can we go online if we're concerned about this? You can. We're not going to tell you no. You need to email your building principal and tell them your concerns and that you'd like to move online. That might take 24 hours to get it started because we have to get everything logged in and ready. But we understand if you're worried, and we're not going to hold you to this. The reason we gave choices is because we knew as this pandemic was happening, people would have different comfort levels, and it's not our job to make a decision on what's best for your family. That's your job. And so we do have those options. You just need to email the building principal. Um, I also have been asked why we're not closing, and I'm going to tell you why. This isn't an easy decision. I, of course, want to protect the staff, protect your students, and I feel a little bit of the burden on my shoulders of this whole community. And that if someone would get sick and someone in the community gets ill, that it's on me. So, what I want you to know is there's not been in our county a confirmed case of something spreading in the school. So, for me, if we had an outbreak at school and all these kids are getting it from each other, that might change the decision, but it's not happening at school. In fact, health officials are telling us just the opposite. Us staying in school is important because we are containing the spread. So when we keep kids in school, they're here where they're wearing masks, they're washing their hands and doing all the things, social distancing, those things. But if we close school, like we're going to for Thanksgiving break, when that happens, people go do other things. They go stay at babysitters. There's lots of kids in houses together without masks. They go visit family. All of those things are making it spread. The community spread is happening in social gatherings. It's not really happening at school. So I understand the question of why not close school, but we're going to stay open as long as we can because number one, we want our kids here and we know that's the best place we can have them. But number two, we're helping to contain the spread. That's important right now. We all want this to end quickly. And so if we can help to contain it, we want to be able to do that the best that we can. Um, I ask that you please, please, please enforce to your kids and remind them that they need to keep their mask on and keep them above their nose. We're giving breaks so that they get breaks. We're doing staggered breaks so they're not all taking breaks at the same time. but keeping that mask on. We have a couple kids that got quarantined because they don't leave their masks on. Keeping the masks on and properly above the nose, because a lot of kids want to wear it below the nose, is so, so important to protecting your child from being quarantined, to protecting our staff, and to protecting other kids. So that is something that I really want to emphasize, along with where when you're sick, don't come to school. If you are feeling symptoms, and sometimes it doesn't seem like that big of a deal, especially when you have healthy young children. So we want you to not come to school if you're feeling sick. We can put you online if you need a couple days. Take a day. We're not doing perfect attendance awards and things like that because we want you to know when your child is not feeling well and stay home. That helps to also contain the spread and contain all of these nights where we're calling everyone and having to quarantine them. We're getting ready to go on to Thanksgiving break. And I just told you that the way this is spreading in the communities is through social gatherings. I have a family, and if you know me at all, you know I am super close to my family. It breaks my heart a little bit to think that I might not be able to have this time with them, but we're protecting each other through that. I need everyone to please think about that as we go into this Thanksgiving break. We don't want to come back with a bunch more of these kids that are testing positive because everyone went and spent all this time away from home and in families and other people's homes. Please, 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 as you make your plans for this break, think about it. Think about the impact that you can make on this community and on our district and school by not doing those things. And then one final thing I want to say is I have to give a shout out to our staff. They've been amazing through this. I couldn't ask for a better staff. They're here, they're dedicated to your kids, and they're doing everything they can to make sure your kids can stay here every single day. There isn't one staff member that hasn't been working really hard to clean and to educate and to do all the things we need to do to make sure that we can do what's best for your kids. So if you see a staff member, tell them thank you. And thank you for all that you've done to help us thus far. We've had one staff member test positive that hadn't been at school for a while and two kids that have tested positive. That's pretty small numbers compared to around the state. So I want to see that continue to be a low number, even though I understand cases are going to happen. Thank you from the bottom of our hearts, and everyone have a great night.